When the patient arrives, we ask them to pick up the white phone in our waiting room just to let the staff know that they're here. We also do want the patient to bring in their photo ID, health insurance card, and a list of any medications that they take. So the patient will put on 2 gowns. That way they're covered front and back. Then a nurse will come in and check them in.
And then once you're all checked in, the doctor will meet you and kind of let you know about everything that will be happening. With that, we'll give some medications which are kind of nice and relaxing, make it so the procedure is essentially painless.
And then once we have you prepared, we'd get you back in the room, make you sleepy, and then look at your entire colon from top to bottom, looking for any abnormalities, including polyps, colon cancer, or inflammation such as colitis or anything else that's abnormal. Preparing for colonoscopy is much easier than it used to be in the past. In preparation, what we have people do is a fairly low fiber diet for a few days before the procedure, and then usually the day prior to the procedure you'll be on clear liquids. You would show up to the endoscopy lab basically what we call prepped or with your colon cleared out and ready for the procedure.
And so that does require drinking some stuff the day prior and in the morning to sort of flush out the system. But those preps to do that have gotten much, much better over the last few years even. So the preps now are much smaller volume to drink, not a terrible taste. So usually it's half the night before and then half the day of. So with that, it's also much easier to tolerate.
In reality, drinking that preparation and then being up a lot of the night going to the restroom is generally the worst part. But for most patients, the procedure is very comfortable. They actually get a little nap even.
Pain is pretty minimal for most people during colonoscopy, despite what we've been led to expect. The sedatives that we use are both pain medications and sort of sleeping medications, and together they usually make most people comfortable.
You know, I would say for the vast majority, they don't feel it, so it's painless and not anxiety-provoking for them.
From start to finish, you're usually here for about 2 hours. The procedure itself usually takes 20 to 30 minutes, depending on how involved each individual's colon and whether there's abnormalities in it. And then following the procedure, there's another 20 to 30 minutes of recovery.
The patient needs to be sure to have a driver who is a friend or family member, at least 18, available to drive them home from the procedure.
We generally expect most people to go home, have a light meal, and take the rest of the day off, sort of having an easy day to lie around the house, no big activities, and no driving.
I think it's great what we're doing. I really feel passionate about helping prevent colon cancer. That's huge that we can just have a patient come in for a simple procedure, take out a polyp, and actually prevent colon cancer. I think that's pretty exciting.